This slide's presentation will cover possible movement system diagnoses for patients post-stroke. So far, we've already covered 3 possible movement system diagnoses, and all of these can occur in patients post-stroke. First is the movement pattern coordination deficit. Second is the force production deficit. And finally, we have the fractionated movement deficit. I've talked about these in detail previously, so if you've forgotten them, please go back and check them out again. New that we're going to cover in this slide's presentation that are also applicable to patients post-stroke are known as the sensory detection deficit as well as the perceptual deficit. The rest of the slides in this presentation will cover each of these in turn. So first up is the sensory detection deficit. And by definition, this movement system problem is the inability to execute intersegmental movement due to the lack of joint position sense or proprioception or multisensory failure affecting proprioception, vision, or the vestibular system. It may be present in the upper extremity, lower extremity, or both. Overall, what you're going to see is this person has difficulty with somatosensation, particularly joint position sense or proprioception. They might also have a light touch sensory deficit. They also may have a visual field deficit that's greater than 50% of their vision. The task analysis that'll give you the most information about the possibility of your patient fitting in this movement system diagnosis is going to be watching them walk. Overall, because of their lack of proprioception, they're going to have variability in their foot placement with hyperextension of the knee during stance and loss of that eccentric ankle control. You should note that this problem with foot placement is going to improve with vision. Okay, another place where you might see it is just basic postural control. So they may be able to stand unsupported with possibly a narrow base of support. So think tandem stance or feet close together. However, they will lose their balance when they close their eyes. Now on to the next movement system diagnosis, which is known as the perceptual deficit. It's actually a problem to resist correction to center of mass alignment related to an inaccurate perception of vertical orientation. This movement system diagnosis is describing pusher syndrome. In general, with pushers, the patient is going to push to one side or the other, most typically to the left side. And remember, pushers is due to a problem in the posterior lateral thalamus. The patient actually feels like they're sitting or standing straight up and down when they're leaning way far over to their affected side. And when you try and push them back, they're going to resist, okay, because they feel like you're pushing them over. Okay, you should know that perceptual deficit, a person can push in sitting, standing, or even walking. They may not push in sitting. If they have a very mild case of pusher syndrome, they're only going to push in standing. Pushers in general, with proper therapy, should resolve in about 6 months. Okay, but that person is in general going to have a delayed prognosis. First, you have to get rid of the perceptual deficit before you can progress forward.